Welcome back to the show. What a great show, because we're talking about so many important topics, and palliative care is one of those topics, especially when we look at our aging population. And there's a wonderful opportunities for those in the profession of palliative care. And I am joined by Laurel Gillespie. She is the Chief Executive Officer of the Canadian Hospice Palliative Care Association. Welcome, Laurel. Great to have you back here.
Thank you for such a warm welcome, Derek.
Laurel, let's talk about the association first of all, and the role it plays.
Yeah, so the Canadian Hospice Palliative Care Association is the national representation, or the voice of palliative care in Canada. So we represent the 10 provinces and 3 territories. And I can tell you that it's access to palliative care is a very fragmented system.
Really?
Dealing with jurisdictional issues from province to province. And so there's a lot of inequities in how that care is delivered.
Can you just expand on that? What sort of inequities are we talking about?
So it depends on the funding models, and different provinces have more healthcare dollars to play with, basically, or to work with. And a lot of hospices that are the bricks and mortars programs, where you actually have a physical place where you can go when you need end-of-life care. A lot of them, their operating budgets, more than 50% come from the communities themselves. So there's no direct standards in how hospice is funded across the country.
The pandemic obviously affected you a great deal, as we sort of, I know it's still ongoing, but you know, a lot of people are getting back to a sense of normalcy. Are you seeing it in the palliative field as well?
Yeah, thank you for that. It's been really rough, particularly for those who are experiencing living with someone that has a terminal or serious illness and not being able to be with them at end of life. So the hospices themselves have had a very difficult time in navigating and managing through allowing families to be with their loved ones. So that actually prompted us to kind of segue through to our Grief and Bereavement Saying Goodbye concert. That people weren't able to say goodbye as we normally would once upon a time pre-COVID.
And what a great success that was. Let's talk about the success. And funding is a big part of putting things on like that. And you know, the funding isn't there, and so this is a great opportunity for us to reach out to the community and tell them about how important and successful an event like that can be.
So November 15th is our National Grief and Bereavement Day. And last year we ran Saying Goodbye Concert version 2.0, which was a hybrid event. So some artists performed live at the NAC with us, and others did pre-recordings, and we meshed them together for an event that we were actually nominated for a Canadian National Award for Live Event of the Year. Although we didn't win, we're going to be replaying that concert this year. So we just couldn't do an in-person one this year. But following that, on the 16th and 17th, we have our Learning Institute, which is an accredited learning opportunity for those in the field of palliative care to have maintenance of certification and main pro credits towards their professional certification, but also for anyone who is in the healthcare space around palliative care, like volunteers or caregivers themselves, to attend, and it is virtual.
So what do you learn? What are some of those components? I know there's some interactive workshops. Just expand on the details of that event.
So it's a bit different from our biennial conference that we host, which is a much larger, broader, more fulsome program. This one's really more hands-on and has more workshops, but each stream has 3 or 4 learning objectives, which are accredited through an accreditation process. And with those learning objectives, there is an interaction to them. So what makes this one a bit unique is I did make the decision, or our team made the decision, to go virtual last sort of fall, or January-ish, because we didn't feel that bringing health workers together in a public space at this time might not be in the best interests of the most vulnerable people that they are working with.
Of course. What about staffing? You know, when I think of healthcare overall, you know, we've heard a lot from, of course, the nursing profession. People are having a difficult time finding a doctor within the palliative care field. Are you having those same challenges?
Absolutely, absolutely. And in fact, actually, Derek, I'm glad you brought that up, because most Canadians walking around today wouldn't acknowledge or know this, is that 35% of us who are working right now are also providing care within the home, either to a child or a person with disability or someone with serious life-limiting illness. 35% a lot of people who are also trying to work and provide care, and it's unrecognized, it's unacknowledged, and I hope that that changes one day soon.
Laurel, you mentioned the different funding from province to province. So obviously a lot of that funding is coming from people like you and I, right? Private funding. So where, is that events that you put on? Is that campaigns? I mean, how are funds raised?
Precisely. So we don't rely solely on any government funding. In fact, right now, we don't have anything from, say, Health Canada to do a specific project. So we heavily rely on sponsorship and donations. So you can always donate for anybody that would like to on our website, and then you do get your tax receipts. So it's at chpca.ca.
And, I mentioned off the top, aging population. Obviously, I imagine you're seeing growing numbers that are having to access palliative care.
Yeah, so we have a number of different initiatives to try to help with what's going to happen in the next couple of decades for us. We have an aging population, but we also have an aging workforce. We need to make better use of our immigrants, as an example, who are coming in, who can fill some of these jobs. Actually provide positions and jobs that allow people to have benefits. So, one of the problems with initial days of COVID was that a PSW was working in 2 or 3 different homes and had to transition between the two because they couldn't find full-time work.
Yeah.
So offer gainful employment to those who are working in that space.
And as you just said, a living wage. Right,
Perfect.
at the same time. Laurel, thanks so much for joining us. Really appreciate it. We'll be right back with more after this.